All right, today we're diving into the journey of long term, specialized care for children with complex neurological needs. We're going to look at how a really compassionate, goal oriented approach can support mobility, comfort, and just overall quality of life. So let's start that journey together. At the very heart of all of this is one single question, a really empathetic one. How do you truly support a child on this unique journey? Because it's not just about the therapy sessions, it's about understanding their entire world and their amazing potential. To even begin to answer that, we first have to get a handle on the challenge itself. So let's take a look at some of the specific conditions that require this kind of incredibly specialized long-term care. First up is a condition called hypoxic ischemic encephalopathy, or HIE for short. Now, that's a mouthful, but it basically means a neurological injury that happens from a lack of oxygen or blood flow right around the time of birth. And this isn't some minor setback. It can fundamentally change how a child controls their muscles and posture, which, as you can imagine, creates some pretty foundational challenges for their development. Another condition you might hear about is spina bifida. This is what's called a neural tube defect. So essentially, it means the spinal cord doesn't form all the way during pregnancy. The impact can really vary, but it often leads to muscle weakness and pretty significant mobility issues. Why? Because that main communication highway between the brain and the lower body has been disrupted. So, what do these challenges actually feel like, day to day? Well, imagine your body doesn't always cooperate. We're talking about muscle tone that can be unpredictable, sometimes too high, sometimes too low, making something as simple as balance a constant struggle. Joints can feel stiff and restricted, and just trying to maintain your posture can be totally exhausting. These aren't just medical terms on a list. They represent a constant daily effort just to move through the world. Okay, so with that context, where does this journey of care even begin? Well, it all starts with the first, and I'd argue the most critical step, a really comprehensive assessment. And this isn't just about getting a diagnosis. It's about creating a personalized map for the entire path ahead. Now, what's so cool about this process is how holistic it is. You see how it moves from the really clinical stuff, like evaluating muscle tone and joint motion, to the super practical, like looking at functional movements, rolling, sitting up. And then, maybe most importantly, you get to step 5, which brings in the family's own priorities. This makes sure the whole plan is grounded in their actual real-world needs. And all of this, every single one of those steps, leads to one crystal clear outcome. The goal isn't to just slap on some one-size-fits-all program. No way. It's to develop a therapy plan that is realistic, that's meaningful, and that is completely tailored to that one-of-a-kind kid. So, once that personalized map is drawn up, it's time to actually start on the path to progress. This is where we get into the nitty-gritty, the how and the why of the therapy and the rehabilitation process itself. And right away, we run into a core philosophy that just changes everything. This quote is key. Progress is measured in functional gains, not just movement milestones. This simple idea shifts the entire perspective on what everyone is trying to achieve. And this slide illustrates that difference perfectly. On one side, you've got the traditional way of thinking, kind of like a linear staircase, a race to a single finish line, like walking without help. But the functional approach, that's a whole different ballgame. It's way more about improving comfort, creating stability, and making it possible to participate more in life and connect with others. It's not about some far-off destination, it's about the quality of the journey, right here, right now. So how are these gains actually made? Well, the techniques themselves are gentle and really purposeful. A therapist might use what's called facilitated movement to encourage controlled responses from the body, or maybe weight-bearing activities to build stability and promote good bone health. The absolute key here is that every single technique is adapted to the child's own comfort level and tolerance. But this journey of care isn't something that's just confined to a 1-hour therapy session. For progress to really stick and be sustainable, it takes a complete ecosystem of support that goes way, way beyond the clinic walls. This chart gives you a fantastic picture of that ecosystem. Just look at this. The biggest slice of the pie at a huge 40% is the home program. That just goes to show you the vital role that caregiver involvement and daily routines play in long-term success. It's a true partnership through and through. A huge part of that support often involves assistive equipment. And this can be a whole range of things, from standing frames that help with posture and putting weight on the legs, to specialized seating systems that provide support all day long, which then allows for better function and participation in activities. But here's the guiding principle, the golden rule, really. The role of all this equipment is not to create dependency. It's actually a very careful balancing act, providing just enough support to improve function while never ever limiting the child's own potential to move. And all of this brings us to our final and maybe our most important point. All of these pieces, the assessment, the functional goals, that whole support system, they all build toward a brand new perspective. It's about completely redefining what we think of as success. This quote from the source material just gets right to the heart of it. Small changes can significantly reduce physical strain and enhance daily care. It's such a powerful reminder that progress doesn't have to be some giant leap. Sometimes the most meaningful changes are the small, consistent ones that happen every day. So ultimately, this is what success looks like. It's not just about ticking a box on a developmental chart. It's found in the real, tangible improvements to quality of life, in better comfort, more stable posture, and the ability to participate more fully and joyfully in the world around them. Which leaves us with this final, really thought-provoking question to chew on. If progress isn't some fixed destination that we're all racing toward, then what does the journey itself actually mean for each child and for their family? It kind of suggests the real value is found in every single small step forward.